All right, we'll call our meeting to order at this time of the Oakland Community Health Network Board. And at this time, please rise and join me in the Pledge of Allegiance. Sheila, could you, or whoever, because you were in motion, if you could please do the roll call of the board members.
Mr. Landsman,
Here.
Mr. Young,
Here.
Mr. Furman,
Present.
Dr. Giles, Pastor Jones, Miss Woodruff, Dr. Hahn,
Here.
Miss Newman, Miss Root,
Here.
Miss May,
Here.
Mr. Torres. He gave notice that he wouldn't be able to attend. Mr. Cowan,
Here.
you have quorum.
Thank you very much. Next, I'll need a motion for approval of our board meeting agenda. So moved. Support. Motion and support. All those in favor say aye.
Aye.
All those opposed, the motion carries. At this time, we have an opportunity for public comment, both online and in person. Do we have anyone online?
If you're online and wish to speak for public comment, please raise your hand. We have one, Salim.
Hello, thank you. So I just want to talk about what's been going on with day programs for people with developmental disabilities. They are really struggling to get by. Some of them are unfortunately going to close down soon, and that is because they just don't have sufficient cost reimbursement. If they did, this wouldn't be happening. People are going to lose their day program. It's something that gives them one of the most important parts of the purpose in their lives, and a big part of that is the relationships they have with their staff, and that's all going to be taken away from them needlessly. I understand you have to save money to be prepared for serious problems, but if this is something that is causing a serious problem, the quality of our people's lives are going to diminish without their day program. It's obvious that, study after study shows that if people with developmental disabilities, they can have a day program to go to instead of just being at a group home or their own home, the quality of their life goes significantly up. They are happier, they're healthier, they live longer. And of course, there's also the 80-cent wage increase that was given to us by our representatives, but our paychecks didn't change from that because a raise was taken away to make up for not getting it. And I think it's just not fair to our people, because I understand you have to balance your budget, but it can't be at the cost of the well-being of the people who need your help the most. And that's all. Thank you.
Is there anyone else who's online?
Anyone else online, please raise your hand if you wish to speak for public comment.
One here in the audience who wishes to speak? No one. Will close the public comment, and there is a second option. At this time, we have a couple of guests um, for stories that inspire hope. So if they would come forward and be introduced, please come up to the front. We're going to need one more chair. Good.
Good evening, everyone. I'm Suzanne Weinert. I'm the Director of Communications at OCHN. I just want to make a quick mention. We have a very busy building this evening. As you can see, there are some other people in the building as well. The Alliance is hosting their open house, and they're also hosting a Narcan training this evening. So I just want to make mention of that so you know that they're also in the building. We have these community events going on in the building. But I'm actually very excited to bring to you our stories that inspire hope, Hannah and Becky Ritchie. And bringing them here today is kind of in honor of National Caregiver Month. Becky is a caregiver to both Hannah and her brother. So you're going to hear from Hannah. Hannah is actually one of our stars in the micro-enterprise world. She joined us last week, her and her mom joined us last week when we hosted the all-provider meeting. And we had our micro-enterprise vendors here at the meeting, and Hannah was one of the keynote speakers as well, and she told her story at that event. She'll be back with us again in December because we are hosting the micro-enterprise as well for our all-staff holiday celebration. So without further ado, I'm going to have Hannah and Becky tell their stories.
Hi. So I'm on the autism spectrum. Of course, that's why my business is called Hannah Joy Spectrum Designs. Yeah, so thank you all for listening to my story, and yeah. That was a picture of me at a craft show, and I was born December 13th, 1996 in California, and I was also diagnosed with autism at the age of 3. And my parents knew there would be challenges, but it was a mystery as to how my life would be as an adult. I overcame many challenges. I graduated from high school. I had my first job within a year after graduation. Even though I had success, I still had and continue to struggle with anxiety. I went to see a therapist. She suggested I find a creative outlet. A friend suggested I go to the art experience in Pontiac. The irony of it all is I never liked art and refused to take it in high school. I began wrapping wire and glass beads around serving utensils. I would post pictures on social media that I made for my mom, and people would ask if they could buy them. And there are some of my pictures. And then friends started telling me I should go to craft shows, and those were a big hit too. And then friends would also introduce me to store owners. And now my items are being sold in 2 stores, in Yellow Dog Marketplace and My New Favorite Thing. My New Favorite Thing is in Waterford. There's me and Tracy, the owner. And then there's Yellow Dog Marketplace. There's my little booth, I guess you could say. And then I have a lot of holiday items too right now. And I just want to thank OCHN, because it would have been difficult to be where I am without the support and I can't see that. Support of places such as OCHN and Easter Seals Morgue. The services that have been instrumental in providing people who come alongside me in my journey. Thank you. And then those are some of my respite and CLS providers who have helped me throughout the years. Yeah, thank you.
Okay, my name is Becky. I'm mom. Hannah did a good job sharing about her business, something that we never in a million years saw coming our way. It really has helped her anxiety, and it's been amazing to see her flourish in that setting. Helped her with so many skills like reading people, money skills, interacting, responding online. And I've just really seen her flourish and come into her own. And I always tell people, a couple years ago we were talking, and I was just telling her what an inspiration she is to people. And she said, Mom, I really want to be a voice for my people. And I just really see her coming into and doing that. So we're proud of her. But our story is, Hannah is 26, her brother's 25, and they both have autism. Jacob is much lower functioning, needs much more care. And the challenges have been immense, especially, throughout the years. And I have lymphoma and rheumatoid arthritis and a bunch of health issues. So I don't know where we would be without our MORC workers. Hannah was just with Gina today, and she helped her run some errands. I always say she's my worker because she helps her run all her errands for her business and work on buying things and purchasing things and organizing. And what a blessing that has been. I really just don't know where we'd be. Jacob's worker, Todd, Jacob's still in the post-high program. He'll be there this year and next year. And his worker, Todd, is a retired special ed teacher. He's just in his late 50s. He picks him up every day after school at 2 and is with him till around 4:30 or 5. They go to Clarkston Family Farm, just a little hobby farm, and feed the animals, and he loves that. And they collect eggs and help with farm work. I grew up in Iowa on a farm, so he loves animals and the farm. And then they go swimming at the rec center, which is so good for him, therapeutic-wise, sensory-wise, and everything, and then brings him home, and then he's pretty much exhausted and eats dinner and goes to his room and watches the same movie every day. But I'm just really, really thankful, and I'm so thankful we live where we do. I have a lot, of course, the special needs community is such a little tight-knit group. If you know one person, you know everybody, I feel like. But so many people in other counties or in other states don't have, when they hear about the services we have, they're completely stunned. So I'm just really thankful. And I would also like to give a big amen to what the guy said online, because we're starting to look at programming for Jacob. And that's something, too, that as a caregiver, we didn't go to school for this, or I don't have training in this, or sign up to be a social worker for my kid, but that's what I am. I was just sharing that we just got a redetermination for Jacob about his Medicaid, and I can fill it out and send it back, but it's just this huge anxiety, like, what if I fill it out wrong? What if I don't get it in on time? What if it gets lost in the mail? Do I need to send it certified? I don't want him to lose his benefits. If he doesn't have Medicaid, he doesn't get anything. And then, of course, the overriding fear of what will happen to them when we're not here. We don't have any other kids, and we don't really. My husband's parents are both gone. He has one sister in Grand Rapids, but my family's pretty much not involved at all. So, our church family has been helpful, but that is an ongoing concern. What will happen to them? Who will watch out for them? Who will be there? And my husband always says, and Yvette knows this, she's heard him say it. She was his boss in years past. He always says, I have to stay healthy. I have to outlive Jacob. And I think that just speaks to the enormity of the weight. I mean, who wants to outlive their children? I don't guess most people would probably say that, because I have cancer and stuff too. But so just the pressures and the loneliness and the isolation, you know, if you do try to share with someone, they'll say something like, "Oh, I know my kid's strong-willed too." It's like, note to self, don't share with them again. They don't get it. And that's okay. They don't get it because they've never been there. But it's just a very lonely journey and very isolating at times. We've really worked to not isolate, but we've had to be super intentional. And there are more and more services. When the kids were first diagnosed, we were in California when Hannah was diagnosed. That was in December of '99, and I didn't know a single person who had a kid with autism. It's not like it is now, where they're like a dime a dozen, it feels like. And we didn't have internet at home. It was kind of just coming out, and we didn't have a laptop. So I remember I had to send to a lending library to get books to read, to learn about autism. And, you know, and then everybody's telling you what you should do, and everybody has a different opinion, and this diet and these supplements, and just the constant pressure to make the right choices for your kid, because we're making all their choices with them, but for them. And so I'm just so thankful for the supports, because the stress, my husband said he read something that said the divorce rate is like 80% once you have a kid with a disability. And so the stress on the marriages, and we just really strive to get out and date, and we use our respite hours. I'm so thankful for that, because basically we still have to get a babysitter. Hannah can stay by herself, but Jacob also has epilepsy, and he needs one-on-one care. I mean, he needs someone with him. And so, you know, like, we can't go to events or do anything if we don't have someone for the kids. So if we didn't have the funding, I mean, I can't pay somebody $15 or $20 an hour to stay with my kid multiple times a week into his 20s. So I think it's saved our marriage. I think it's benefited our family, and helped our kids achieve what they have. Because I have supports, I can be more available for Hannah, for her successes, and Jacob's as well.
Well, first of all, thank both of you for coming and sharing your story. And Becky, don't let anybody fool you. You're an inspiration too. And you're not alone. Almost everyone on this board has a child who has challenges. We've lived through that. Or they have professionally worked, or have someone, you know, with children, or they have a family member. So everything you said, I understand, and all of us do. So that's what we're here for, to help and to guide our staff in their tremendous work that results in all the positive benefits that you've seen. Hannah, I had to laugh because I didn't like art either. I still don't like art. There's not a creative bone in this body. But you said something about online. So do you have a website? And if so, we need to know what it is, because this is your chance.
So I'm on Facebook and Instagram. It's called Hannah Joy Spectrum Designs. It's a public page. Okay. There is a private page on Facebook, but don't go to that one. Go to the public one. But yeah, you can order through there, or you can email me at hannahjritchie@gmail.com.
Okay, so hannahjritchie@gmail.com. And what was that Facebook page again?
Hannah Joy Spectrum Designs.
Hannah Joy Spectrum Design.
We were going to do a website, but we're too darn busy. We don't want to advertise anymore. Mama's tired.
Somebody has to update it and monitor it and all that.
And make more. Like when we were here the other day, and then we were here, I think, on a Friday. Tuesday. Okay, and then we had a show on Friday and a show on Saturday.
So, Hannah, where are your next couple shows coming up, like this weekend?
Weekend, I have one on Saturday at Troy High School.
Okay.
It's called Elf Shelf or something like that.
Okay.
Yeah. And then next weekend,
that's the church thing. The 9th, you're at?
On the 9th, I'm at Our Lady of the Lakes in Waterford.
And the 16th?
And the 16th, I'm in Novi at the Suburban Collection Show Place.
There's like 400 vendors there.
You're like on the circuit here, because I don't want to share too much about the Cowan family, but everybody and the in-laws and outlaws, everybody goes on to these shows. So I'll have to make sure. You know, I know a couple of them are on the list, so that's wonderful.
We've been to Charlevoix, Petoskey, Traverse City.
Yep.
She was just at Recon, I'm sure you guys
In
know.
Traverse City, yeah.
Okay, so what's your hot item this year? What are you really trying?
Well, I started making some ornaments. They're beaded ornaments, and those have been selling faster than I can make them.
Okay, well, you might have to look at expansion.
I know,
You
we
know,
gotta hire.
that's right. We can find somebody to work with her. There we go. All right, okay. Well, good. Anybody, yeah. Oh, I'm sorry, Sarah, please. Yeah.
Hi, Hannah. I think I remember you from when I first started on this board. Were you virtual? And I thought we talked about your crafts. Did you?
Yeah, I think was that the award thing that I got?
Yeah.
The Ability Champion.
Yep.
I remember. You've come a long way, I see, doing all the shows and stuff now that COVID's lifted.
Mm-hmm.
And, you know, I have a 19-year-old who's also on the spectrum. I mean, she could put her to work.
Okay.
Mom could retire.
Right. And,
I love it. Mom's always looking for a job for the kids.
I mean, I'm here for it. Crafting is amazing. And then, Becky, right?
Mm-hmm.
Everything that you said rings so true to me, and the support is so important. And as our kids age, while we're so happy and proud that they're aging, it gets scarier and scarier for us. And I just want to let you know that I feel you.
Yeah. Yeah, we just opened our first My Able account. I mean, you have to talk all the time about when you're not here, even with your kids. Like, who do you want your standby guardian to be? You know, it's just,
Right.
yeah. So.
Anyone else have any comments or thoughts? Okay, Malkia?
I just want to thank you both for coming and sharing a very inspirational story.
Thank you.
And how did you come up with the idea to put
Well,
these on?
Well, I started originally, with the silverware, my mom had I was just starting to do some stuff with wire, and my mom had an idea to wrap it around silverware, because she was gifted one, like, 15 years ago. And, yeah, and then I would try to post them to show what I made for my mom, and then 4 different times people asked if they could buy it, and then after the 4th time, it was like, okay, maybe we should try this.
And that was 5 years ago.
Wow.
So we've been doing this for 5 years.
It really
Amazing.
picked up during COVID, too.
Well, thank you so much for
Thank you.
sharing your story. And I wish you continued success with your business.
Thank
Thank you.
Okay, Dr. Hunt?
Well, this is really an inspiring story and brings tears to my eyes. You are such an inspiration. I wish that I have a son on the spectrum as well, but he's lazy. It's very difficult to motivate him. He only wants to do art, but it only has to be painting, nothing else, or ceramics, which there aren't very many opportunities for him to do. You could be a mentor to so many kids. This is really inspiring.
Thank you. I say that all the time. When my kids were, 2 and 3, and I just found out they had autism, I would have loved to have met a Hannah. It would have encouraged me, because you're so overwhelmed. I mean, they term it a life-altering disability. It's like, thanks, and you don't know what you're doing. And so I would have loved to have met someone like Hannah, and that's what I told her. She really has an important calling, I feel like.
Well, we'll have to make sure that calling gets met. She's already doing a tremendous job.
Thank you.
I want to thank both of you for coming, and Suzanne, you're smiling, because this is one of the fun things you get to do. So, all right. Well, thank you, and best wishes. Happy Thanksgiving and Merry Christmas.
Yeah, thank you.
We have to go home and do some work now.
That's right. She's got a
I'm
show
not
coming
joking.
up. She got a show coming up.
Yep.
No rest for the weary. Okay. All right, it's going to be hard to top that tonight. Next, we have on our agenda a few reports. I'll lead off. I've only been chair for a month, so I haven't had a chance to do too much. But we did go. I did go with others, with Dana and Jonathan, and Dr. Giles and Malkia Newman. We went up to the annual conference of Community Mental Health Organization. It was very enlightening. I'm glad. I know Jonathan's been after me to go, and I'm glad you didn't give up, and I learned a lot. The one unfortunate thing is we tried to get a handle through the various discussions. We had legislators, we had folks from Michigan Department of Health and Human Services, high up. But the bottom line is we don't know what the future holds with this whole redetermination effort, and that is a little bit troublesome. You know, we're gonna get through it. We've got a good team, and whatever happens, we this is something that's totally out of our hands. But we are monitoring it very closely. It's kind of like waiting for the ball to drop, and it's not New Year's Eve, okay? So it's the bad ball, and that would affect finances and perhaps the delivery of services. That's the most important thing. The bottom line here is not money. The bottom line is delivery of services, as we've just heard, a tremendous success story. So we're hopeful we're going to continue to work on that with our lobbyists and other consultants as we get more information from the state and move forward. So that's all I have to say. Yvette Woodruff, I'm our Chair of Policy Management.
Okay. Last week at our Committee of the Whole meeting, there was a presentation by the clinical team that is associated with the Children's Crisis Unit. They basically did an overview of the SAMHSA grant, whose funding has ended at this point, but they shared some of the statistics. But a lot of it is skewed data because of the fact that they started during COVID. And they talked about what they're doing in terms of trying to get additional funding, but Medicaid is covering, and no one is being turned away at this point. And they're hoping that there will be other grant opportunities, and they're also possibly seeking accreditation for that so that they can be open to other third-party payers as well. That kind of concludes what happened during the policy meeting.
Thank you very much. And now we'll have the Finance Committee report given by our Vice Chair, John Young.
All right, thank you. So at the COW meeting, the financial update was not able to be provided because we were waiting more final numbers, but we have, next item will be the financial reports that Cheryl and Patrick will give as the, the challenge is it's not like a magic year end. It's year end and then all the reconciliations and then all the providers reconcile. So it does roll forward for a while. So these will be what we'll call preliminary numbers because we're a bit away from the audit. Also under item 3 here, the board approval items, they were presented and we recommended to the full board board approval item 3A, and then also had a presentation on employee benefits, which is represented here under board approval item 3B. So that was our meeting. Now we'll turn it over.
Welcome, and if you want to give us the September, which for those who may not know, September 30th is also our year end. So that's an important milestone that we take a peek at. So, finance team, take it away.
Good evening. I'm Cheryl Johnson, the Chief Financial Officer.
Patrick Franklin.
Okay, the first slide here is the MD HHS payments for the year. They were pretty consistent over the year. There was a slight increase from May that went through the end of the year. September decreased a slight amount. And the line across the top is where we were last year, so we're pretty consistent with last year also. Next slide, please. These are the eligibles. This comes from the Power BI report. Again, we're fairly consistent. There is a slight decrease that you can see happening at the end of the year. The majority of that is TANF, which is the temporary. We're keeping a close eye on this because we do expect there to be a decrease going forward. Next slide. This is our asset comparison for the year. As you can see, cash and investments are pretty close to what they were last year. There was a decrease of about $3 million in receivables, which was basically based on timing. Other assets is fairly consistent with last year, and capital assets had a decrease, but that was just due to depreciation of mainly the building over the year. Slide. As far as liabilities, our accounts payable went up about $3 million. Again, this was due to timing of when payments went out compared to last year. Due to the state and employee payables remained fairly consistent, and long-term debt had a decrease due to our payment on notes payable and capital leases for the year. The net asset comparison, total assets and net position went down approximately $7.5 million from last year, and that is due to our net loss for the year. Anticipated net loss for the year, sorry. Okay. Revenue comparison, we had an increase of almost $40 million in Medicaid based on last year. The other funding sources have remained fairly consistent. Next slide. Our expenses, we had about a $42 million increase to the provider network that happened over the year. The majority of that is due to the fact that we pushed out stability payments, cost reimbursement, employee staffing, and additional DCW premium pay. Next slide. Net income comparison to last year, we had a loss of about $10.9 million last year, and we're projecting a loss of about $7.5 million this year.
Does the board have any questions? I want to stress that these year-end figures always go through adjustments. Yeah, there's, I think, some settlement of accounts with some vendors that'll happen also, as has happened in the past.
Right.
But this is the information we have today.
This is the information we have today. There are cost settlements that will happen, and the providers have to provide their audits 105 days after the end of the year. So until we receive all of that, there will be some fluctuation, and then our audit will happen too. So the numbers will be firm as of February.
Right.
But we're pretty comfortable with where we stand right now.
Right. Any questions? Mr. Lansman?
Thank you. So we had a loss of $7.5 million last year. In the year
In 23.
In 23, in this past fiscal year, and a loss of over $10 million, almost $11 million in the year before. So we've, over the last 2 fiscal years, we've pretty much drained all of the reserves we had.
Yes, we did.
So there's no well to go back to for us.
That is absolutely correct.
Okay. So I knew that from reading it, but I just want to say that out loud. So it's not from a lack of getting revenue, because as people saw, we had $50 million, almost $50 million more in revenue from the state over the past year, but we also spent it on services to be provided across our service network.
We spent just about everything that we could.
Yep. So it's going to now take us the next 6-8 months to true it all up, go through the closes, and then report it in June, because that's when we'll probably have our audit report. Correct?
Correct.
Okay. Thank you.
Christina?
I think I'm a little confused on the difference between the net income here on this slide versus the net position that was on another slide. So
net income is what happened during the 1 year.
Okay.
Net position is where we are overall.
Okay, and could you state again what the net position is, or what it's expected to be?
We went from
Go ahead,
50,
sorry.
I think we went from 61 million is 53.
Right, exactly.
Okay. Thank you.
And this is just the trial close. I mean, this is not the real close, this is just the data as we know it right now, right?
This is the data as it is right now. And again, there will be a few fluctuations once we get the other information, and we have to have the statements audited.
Anyone else? I do want to mention that, first of all, the organization is solvent. I don't want anybody to think anything else, but we did know that there was going to be a negative position this year, not negative position, excuse me, a net income loss. As we transition out of the COVID flow of money and that reduces, and as we know is coming with Medicaid redetermination, will be some additional slowdown in revenue, or there might be some transition point if the state decides to increase their rates. And this is all unknown. This is why it's a little bit frustrating, because we can't really chart a course. We are just kind of live day, we live in paycheck to paycheck like everybody else, I guess, is what it comes down to. But we do have a plan this year. We have a budgeted,
Surplus.
budgeted increases in our reserves. We'll talk about those possibly next month. And the other thing I wanted to mention, that I believe is a very important thing for us to tell the community, is that if you add up all the income, we have $488 million, and our administrative cost is about $29 million. That's roughly 6%. We've always fluctuated since I've been here between that 6 and 7%. And I would challenge any organization that we get 93 to 94% of the dollars that we come under our jurisdiction go out for services and to the provider network. So that's a very important thing, and I'm very pleased to see that, despite the fact nobody ever wants to show a loss. But we're not a for-profit organization. We're supposed to get all the money out, and if we're a few dollars, a percentage point or two off, that's what's happened. But we do have to now, in earnest, try to rebuild those reserves as we move forward in this coming year. So that's what our budget says. That's what we're going to do. I just want to thank all of you. I know since March, it's been rocking and rolling, up and down, and Cheryl, we're glad to have you on board and your experience. So I think we have nothing but good things to look forward to until we hear from the state.
Right.
Memo to follow. But I am very pleased about that administrative expense, that we've been able to keep that at the same type of level that we've had historically.
And we will keep a very close eye on everything, and if we see anything starting to change or any trends, we will bring it to you as soon as possible.
Thank you very much. All right. If there's no one else, then we'll excuse you, and thank you very much for the update.
Great, thank you.
Thank you. All right, we'll move on now. We have two approval items tonight. First is, and this was discussed at our committee of the whole, and the first is our Public Act 152 resolution. We need a motion and a support.
I think Ms. White wants to provide a follow-up update.
I'm
Just
sorry.
a small
Okay,
update
just
to some
a small
questions.
update. I apologize.
Yep.
Edna, I did not mean to steal your thunder.
Not a problem. I am here to provide a small update. I was asked to provide some additional information from my board member Woodruff, and so I did do some calculations, and I have some comparison data for you. And in case you have any questions, I'm here as well. So the question that was put before me when I presented to the board at the Committee of the Whole meeting last week, I indicated that with the increase in premiums that we asked the employees to pick up, their cost share of the overall benefit expense was going to be 15.57%. And the question came, what is the cost share this year? And that is 12.96%. And the prior year, it was 14.04%. And that number will fluctuate depending on what our experience will be, since we do fund a health reimbursement account. So I wanted to provide that information. And at this point, I'll close down my thunder, and if there's any questions, I can take.
Okay, all right. So we do have a resolution. It is the resolution. We have to opt out under state law of certain restrictions and benefits so we can provide the benefits that we believe are appropriate to our staff. So I need a motion and a support.
I'll move for approval.
A motion for approval
I will second.
and support. Is there any discussion? There being none, all those, we need a roll call vote.
Miss May? Yes. Miss Root? Yes. Miss Newman?
Yes.
Dr. Hans?
Yes.
Miss Woodruff? Yes. Dr. Giles? Yes. Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Landsman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Edna, is the next item, is that the approval of the Blue Cross Blue Shield contract, so we can offer that to the employee, then we can start our opt-in or roll-in sign-up period?
The open enrollment.
Open enrollment, that's it, you got it.
Yeah, so the open enrollment, that will proceed. However, because of the timing of the time we get the quote with the Blue Cross folks and the approval of the package from the administrators, we will be getting the actual contracts for signature in the coming weeks.
Okay, so we just need a motion for approval of the benefits?
Yes.
That were presented last week, okay.
Move for approval.
Support?
A motion and a support, is there any discussion? Yes.
Yes, I need to recuse myself from this because I work for Blue Cross.
All right. That recusal is accepted. Is there any further discussion? Our roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Yes. Miss Woodruff? Yes. Dr. Hans?
Yes.
Miss Newman? Yes. Miss Root? Yes. Miss May?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. The next item is our consent agenda for approvals of various board minutes. A motion for, is there support? Support, thank you. A roll call vote, please.
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Miss Woodruff? Yes. Dr. Hans? Yes. Miss Newman?
Yes.
Miss Root?
Yes.
Miss May?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Next item is kind of a catch-all other business. I don't think we had anything else to follow up on today. The next we have is our board reports. First, our Recipient Rights Advisory Committee. Dr. Hans?
Yes, the Recipients' Rights Advisory Committee met on November 2nd. Several items there are standing agenda items like introduction of the rights staff, and they usually make a presentation as to what their workday looks like, what their responsibilities are, and how it impacts the services to the people. Goals for fiscal 24 were finalized. Some of important concerns came up. One was that individuals really don't know, especially filling out forms, applications, etc., and they need help with that. And that brought up also the concern that support coordinators really are so stretched in their responsibilities and their caseload that there isn't enough time for them. So that is becoming a difficult issue for people. There was also concern about that board carefully review the periodic reports and have some study sessions dedicated to rights, or at least learning about rights, because it has direct impact on the quality of people's lives. And so therefore, it is our responsibility to be familiar with ongoing issues with the people. Site reviews were completed at the, they were supposed to have been completed at the end of the fiscal year. They are 99.8% complete. There was one site that could not be reviewed because of COVID among the staff, so that was expected to be completed middle of October. That's my report. I want to mention that I will not be able to attend the December meeting. I will be out of town. So if there is anyone who would like to substitute for me, I'll appreciate it.
Okay, we'll try and
Thank
enlist
you.
a volunteer. Is there anybody, or maybe they got to check schedules?
Next meeting is December 7th at 4 p.m.
Okay. Sheila, if we don't get someone tonight, I know people are going to check schedules. Would you make sure you get something out to everybody, because we really need to have a board member there?
Sure.
Okay, thank you.
Oh, there was one item I forgot to mention in my report is there is routinely review of the recipients' rights policies. So the RR policy 9.1 and 22.1 were reviewed. That relates to abuse and neglect. There was a quite significant discussion on that as well.
Thank you very much. Is that your report? Thank you. And then next we'll have the Citizens Advisory Committee, Christina Root.
All right. So I will be giving updates from the past two CAC meetings. The first one was on October 18th, which was a hybrid meeting. Agenda topics included voter rights, provider reports, and a discussion about ground rules to ensure that meetings are just conducted in an efficient way and that everyone feels safe and respected in their meetings. And then the November CAC meeting was held on the 15th last week. So they had the committee elections, and I can report that Matt Fritzen was reappointed as the chairperson, so congratulations to him. Other agenda items included OCHN updates shared by Christine Burke, provider updates, and a conversation about possibly changing the monthly CAC meeting date, because normally they have their meeting after, I think the Wednesday after our general board meeting, so it's been kind of tough to, make sure that we're both on the same page and just kind of talking about the same things. So I'll keep us updated on that if we do end up changing the meeting date. And then lastly, I was asked to circle back to an issue that the CAC had addressed in our September meeting as a board. So if you recall, they had submitted a resolution to us, and it was to restore the public comment, the allotted time to 5 minutes rather than keeping it at the 3 minutes. Yep.
That was done during public comment, so I don't know
Am I not?
how the board wants to proceed, because that was a public comment, and normally we don't respond to the public comment. I just want to remind the board how that was presented.
Yeah.
Well, as a chair or as
Yeah.
the liaison, though, I don't see how that's an issue.
I appreciate, I read that resolution.
Okay,
And I
yeah.
appreciate it. If someone believes they need more time because they have to make a longer presentation, when we had that discussion, we're more than willing to accommodate them if they need the time. But generally, I think we've seen most people come up here, the 3 minutes is not a difficult task. So I haven't had anybody on the board say we should change that, but perhaps, unless the difference of opinion here, and everybody has a chance to say something, if they feel, if they have someone coming up and they feel they need more time, let us know.
I do think, just my personal comment for that, maybe we should have that stated formally, because I don't think that's in the verbiage that we have, right, about public comment, and it does seem less inclusive, right? The comments from the CAC were about just making it more inclusive in case someone did need some extra time. So,
and we do have people who, tonight we had an individual who's very, very can speak very well. We've had others who it takes them a little bit more time, and that's fine. We're here. We're patient people, and we're here to serve them. So if they believe they'll need more time, and I think we could add something to that.
Okay.
Okay.
So maybe, do you want me to go back to the December meeting and share that comment?
Unless there's a disagreement, I think we're yeah.
I kind of think that asking the public to request more time puts an undue burden on somebody who might need it because of a disability or a mental health need. Like, say the person has a stutter. Them even having in their time to ask for more time is going to take up more time. Instead, just extending it back to 5 minutes, and they don't have to utilize all of it. If they need it, then they take it.
And to follow up that point,
Go ahead.
sorry.
So I do recall when that came up. I believe I was the person that was suggesting from our board that we go back to our 5 minutes. I was the dissenting perspective. Most of the board said that is fine, and what I've done over the 3 years where I ran public comment, I allowed latitude when we had it and we didn't have a policy itself, and I think Dennis, as our chair, can offer that latitude when needed. But we need to have that time constraint in place so that it's not taken advantage of by the general public. We want the voice, and if some voices need more time, it's to the discretion of the chair to offer that. And he has, and I know I have.
I do want to remind the board chair, too, that the online form does ask if more time is needed and that we could assist. So we do see that if they fill out the online form, that we are there to accommodate that.
Right. Okay. So we can't revisit that issue tonight. We'd have to schedule it. If people feel very strongly about it, they're more than willing to do that. I think I don't think we've even had this policy in place for a year yet, and I think we ought to let it ride a little bit. And if I have discretion, and we do have people who if they think they are going to need more time, will be allowed more time. If they ask for that. Yes. Okay.
I think another reason why the CAC was a little perturbed is because they didn't get an opportunity to weigh in before the vote was taken.
Okay.
And they felt that part of their responsibility is to advise the board. So
okay, that's a point well taken. If we make another change, we'll ask them for their opinion. Seriously. Okay. All right. Okay. At this time, we'll move on to public comment. I'm sorry. My oversight, Sarah. I'm so sorry. SUD Oversight Policy Board.
You just oversighted the oversight board. The SUD oversight meeting was called to order on October 25th at 1 p.m. here in this room. We had the CFO was introduced to us, Cheryl Johnson, and then we had a provider presentation. It was, again, the Alliance of Coalition for Healthy Communities, which are our Save a Life boxes. Steve Norris gave us an update, and the boxes, they're like newspaper-style boxes that contain nasal naloxone, which is Narcan, fentanyl testing strips, xylazine testing strips, and prescription drug charcoal neutralizer pouches that they can access 24/7, typically in like a well-lit area where people can access without feeling watched. Due to the initiative, the life-saving supplies that have been spread out in the community have increased over 400% in 2023. And there are currently 60 boxes in our communities. Data is tracked every 60 to 90 days, and if usage is low in whatever location that the box is placed in, the box is moved, and they immediately always see an increase. It's only happened twice that it's had to be moved. Also, there's some really cool info. Steve said that he's being contacted by other communities outside of even the state of Michigan that are asking for the boxes, so they're purchasing the boxes from us and following the program and using them in their own communities where they provide the testing strips and the Narcan, but they get the box from us and use our program, which is pretty cool. And then there's also information about NA and AA, and then brochures for us in our community. They're really cool. If you haven't checked them out, there's one like right outside the entrance over here that you can always check to see like what's in it and see what they look like. Let's see what else. We had updates from the quarterly financial update. We also had an update regarding legislative, different, laws coming up. HB 4707 is a pretty exciting law. It's a insurance parity law that's being put through regarding private insurances need to provide the same sorts of SUD and mental health care that we do. And that bill has now actually moved on to the third reading. So the second reading was passed finally, but the legislature won't be back in session until January. They left in early November. So it's currently sitting waiting for a third reading. We had treatment provider update, and we also have one open board position still on the SUD oversight, and we currently have no applicants, and there's no requirement. So if anybody wants to apply, all right, and that's it.
Thank you very much. At this time, any questions from the board for any of our reports? Yes.
Sarah, if someone wants to apply to that board, they need to reach out to the Oakland County Board of Commissioners, correct, to be on the oversight board?
No, I believe it's just OCHN. It's right on our website.
It's our website?
Mm-hmm.
Okay. Thank you.
Thank you. Next is our second opportunity for public comment. Do we have anyone online?
Mr. Chair, can Christine provide an update on the Tri-County meeting real quick? I forget.
Oh, absolutely.
Okay.
Sure. Right, because we have that on the 30th. We're hosting it here.
Yeah, next Thursday.
Next Thursday, we're hosting it here.
Correct.
Right.
Good evening. Sheila and I were reviewing our RSVPs and wanted to give the board an update and also get some input. So we have received RSVPs from 14 people. Only 6 are planning to attend in person. So the remaining 8 are planning to attend virtually. So we wanted to ask this board if you would like to still hold it in person, or if you would consider or want to consider switching virtually.
Do we know if that's from all 3?
Yeah, that's from all 3.
Is there a conflict? Because I know I'm kind
Both
of surprised
have
because
confirmed there's no conflict.
No, there is no conflict. We actually chose the date for them. I know that they have been hosting virtually. We have been doing the meetings in person, so it may just be a preference of the other counties. But we did plan the date according to their schedules and availability.
Are the 6 us or somebody else?
No, no. I double checked that. No,
I know.
yeah,
Well,
all
but-
14 are from the other counties, and the 6 that have RSVP'd are from the other counties as well.
Well, some of us are gonna be here for the executive committee meeting at 5, so I don't have a problem if we do it. You know, I mean, those who are here can be here, and then the rest can attend virtually if they wish.
All right, that's perfect. We just wanted to make sure you knew, so you didn't get here and say, hey, where are all the people? The other thing I just want to confirm, and when we were scheduling the meeting originally, was that we did want redetermination to be the primary topic. We'll probably have CMHA to come and give a legislative update and more extended if there were any other priority agenda items that you wanted to include. I'll be sharing the agenda with our counterparts on Monday.
I think that's the main issue right now.
All right, thank you.
I think.
Go ahead. For those of us that are here, do you want any of us to RSVP or just through, our normal
Just a
portable?
normal
Okay.
portable sign.
Okay. I haven't done it yet, that's why
We know.
I'm sorry.
All right.
That little
Thank
green
you.
button.
Did we have anybody online for,
We do. If you're online and wish to speak to public comment, please raise your hand. First, I see Ben.
Hi, my name is Ben Quigley. I work for New Gateways. I just wanted to say, with the dollar raise that was taken away, I really think it needs to come back, or it needs to be implemented. I'm actually having a very hard time and was hoping that raise would come on, because it's going to benefit, one, my children, and being able to provide for them more. It will also provide more DSPs coming in, because they'll see that raise and they'll want to apply more. They'll want to come and actually get down the wait list that so many different companies already have. Like my company itself, I think we have near 80 to 100 people. And I would like to see them have services that we're not able to provide, because a lot of DSPs are looking at this and going, well, we're not going to make enough to be living on. Giving that dollar raise is a good step forward to being able to get down the wait list, to be able to make a livable wage, and to provide the services that I'm assuming everybody wants to provide for everybody that needs it. Thank you.
thank you. Anyone else? Is there anyone in the audience? There being no one, we'll close the public comment, and now we'll move to our director's report from Dana.
Good evening again. I will go through my report, and hopefully you have a copy of it in front of you. One of the things I wanted to talk about has to do with National Family Caregivers Month in November. And I think we all know, especially with the presentation we had, Our Stories That Inspire Hope, how critical caregivers are and our family of caregivers are. So just wanted to recognize that. We did share this information in our communications with the county and other stakeholders to make sure that we recognize and thank our family caregivers. The other thing I wanted to recognize is our OCHN Veterans Navigators. And I'm not sure if we have any other veterans in the room, but we do want to recognize and acknowledge your service. And that's so very critical that we recognize the hard work of the men and women in the military. So I'm not sure if we have anybody, if we fail to recognize anybody. We know we have the best navigators in the state. We actually were told that during our last conference at CMHA in Traverse City. So that's exciting to know that our own Shaka is one of the ones that is considered the best in the state.
Yes.
The other thing I wanted to recognize is that we were named 2023 Michigan Top Workplace by the Detroit Free Press. And for what I've heard from Christine and previous people who are still here, or people who've been here a while, this is the first time that we actually won that recognition. So I'm excited for our team because of the hard work we're doing to be recognized as a top workplace. We actually are also women-led top workplace and top workplace for DE and I. So I kudos to the team, because we don't do it alone, we do it together as a team. So I'm excited to recognize all of our team members. So I have a lot of information about access and the screenings that we do, and all of the things that you see in my report are really tied to our strategic plans and our efforts that we make to make sure that we're in alignment. Because we don't want to do anything without looking and tracking and looking for good outcomes for the people we serve. And so when we find problems, we also recognize that and want to correct that as well. So I'll also say that our relationship with the county is very critical, and some of the things that we're doing with the county really do improve outcomes for the people we serve. So we talk a lot about our crisis initiatives as well as our law enforcement partnerships and training, but one of the more recent things we've done is through a grant, we had additional COVID testing, and we shared that, and we were able to distribute that to the community with our Oakland County Health Department partners. So we're proud of that work. Let's see what else. We do a lot of community outreach, and I really want to encourage all of our board members. We have board members that do attend when they can. We really do appreciate it, and it makes our teams feel good when they see you all there and in support. So thank you for that. The other thing I wanted to share is really our provider appreciation meeting we had last week. I actually missed it, so Adam took the lead in that, and it was a good meeting with good outcomes. And actually, we had some good feedback from the providers that were there. They really liked the format and being able to ask questions and for us to address any current events that are coming up. Lastly, if you look at the last page of my report, which is really important. Well, let me go back for 1 second. We also did a press release with the Oakland County Sheriff's Department on a new anti-overdose drug called OV. So there's still a lot of new information, but we actually funded this pilot with the Alliance as well as with the Oakland County Sheriff's Department to purchase OV to try to use it to prevent overdose deaths specifically related to fentanyl. So with more information, we'll make sure that we get that to this board. I did want to bring that up in case it comes to your attention or somebody asks you about that. And so the press release went out, and any other information we can provide, we're working really closely with Dr. Posios to make sure that we get the information out, but also educating the community, which is really important. So lastly, I wanted to recognize we have 3 stars in our team. We have more than that, but 3 stars I really wanted to recognize. Rachel Rose was identified as OCHN's prevention coordinator. She's the preventionist of the year at the state, so that's huge. So we recognized her on several events and opportunities. We want to make sure we show people here who are doing the hard work how much we appreciate their talent and their time. The other thing is our access manager, Tradina Taylor. She's featured in Metro Parent Magazine talking about how to access services and how to connect people to substance use disorder treatment. And finally, our Director of Training and Justice Initiatives, I think you all know Trish Zazimbo. She is named in Crane's Detroit Business Notable Leader in Diversity, Equity, and Inclusion. So we have some great folks working here on our team, and so if you would join me in just recognizing them, I think it's really important. They love to hear from you all. They hear from us, hopefully all the time, but they love to hear from you all as well. So thank you.
Thank you. At this time, we have an opportunity for board member comments before we conclude the meeting, and we'll start over with Adam.
Yes, I'd just like to say thank you to Cheryl and Patrick for the financial update, as well as Hannah and her mother with Stories That Inspire. A lot of the board members commented after the presentation directly, but yeah, just a really inspiring show of just some of these unique talents, and again, keep up the good work, and have a good night and have a good holiday.
Sarah May?
No comment.
Dr. Hans?
Yeah, I saw Vicky just left, but I wanted to give a shout out to Vicky for recently there was a webinar on supported decision making toolkit, which was very helpful. I My son has received services for over 2 decades from OCHN, but there was a lot of new information that I learned how to navigate IEPs, IPOS, and all the other stuff that was there. Really amazing presentation. I just wanted to thank her for that in person. And also, ARC of Oakland County is doing a lot of work on redetermination, especially for dual individuals, which is really a little more complicated, and there are a lot of glitches being faced by families on that. Couple of other things that have been on my mind is a mental health crisis in the healthcare provider community. The suicide rate among ER physicians and nurses is going up, and I'm sure Dr. Giles can probably throw more light on this. And in our own community, I'm noticing that the support coordinators are almost at a breaking point. So I think that is something we should keep in mind, that the support in that area is so critical because it directly impacts the people that we serve. The other thing I'm hearing from the community, in my community, vaping among middle school children has been observed. So that is something also that should be on our radar to monitor, perhaps in this current academic year or going forward. And still, there have been reports on mental health crisis in pre-adolescent children. So those are a few things that we should be kind of keeping an eye on and see where are opportunities to be of service to those communities. Because I don't think that education department by themselves can handle it, although a lot of the support coordinators are leaving and going in that direction, or with private insurance companies, etc. So, yeah.
Thank you for those comments. Yvette Woodruff?
I want to thank the
Jonathan Blanton?
Thank you. I want to thank the finance team for doing what they do. That's why they always have an acorn on the nautical flag, because you guys are there to store all the nuts, if you will, the acorns. But thank you. It's in learning how we do accounting in this sector is going to be a lot of fun. I'll just tell you that. Versus what I knew about commercial, utility, and healthcare. This is very different, but I know you'll get it. It'll be fun. And also the Stories That Inspire is still my favorite part of every meeting. I've always said it when I chaired these things, but it moves me. It's our folks, good, bad, or otherwise, what they're going through. We need to keep, that's why we're all here. That's why we have to thank those that serve those folks too. So thank you.
Oh, yeah, thank
Sure,
you.
yeah.
Christine, for the meeting next week, so when we're going to talk about redetermination, we heard another example of somebody who's getting the packet and feels helpless and overwhelmed after dealing with it for 20 years. So this is real, and the state's got to start dealing with it. It is just, it's a lot of things, but right now it's not fundamentally fair. The other thing that, as I listened to her, and she's been dealing with it for a while, but to facilitate some ways of connecting families, too much of it's relying on a random hit from Facebook, and with all due respect, there's a lot of garbage out there, but there's also, she made a point which is true, but it relies on who you run into at church or the grocery store. Families in this world connect with each other. and we need to figure out a way to help with that, you know, so there is sense. Because everything she was mentioning, I could think of 3 people she could talk to that would help. And lastly, to agree with everybody, thanks on the finance report. It's good to have it kind of back again. We know that the depth and the juggling that has to go on with year-end closing and with all of our providers. I'm hoping they're taking it as seriously as you and Patrick are. Thanks.
Melchiah Newman.
I want to congratulate the staff on being named a great place to work, or however it's listed. It's so easy to criticize people when they're not doing a good job, but I would like to be one of the ones that give people their flowers before they die. And I really appreciate Dana and the rest of the staff for all the work that they do. And we'll never know the whole extent of it because that's not our role. But I do want to acknowledge the staff and thank you for the presentations and everything that you do. And I also want to wish everybody a happy Thanksgiving if you celebrate it. And I also would like to acknowledge the indigenous people who were here before us. Thank you.
Dr. Giles.
Well, I don't want to be repetitive. I almost said no comment, so I'll just say thank you to everyone, especially Hannah and her mom, Becky, for the presentation. And just to echo what Dr. Hans has said is, of course, 988, the hotline, it works for anyone, and you're exactly right, mental health crisis for those individuals working directly with individuals and outside of that. So just, I guess, keep in mind when you interact with all people, you never know what they're dealing with or what's going on, you know. That's it. Thank you.
Christina?
I recently joined a suicide prevention cohort through Jewish Family Services, and next month I'll be doing a 2-day training. It's called Assist. I don't know if we offer that through our network, yeah? Okay, awesome. Yeah, I'm really looking forward to that because, yes, it's terrible. Children at a very young age are struggling, and adults as well. So thank you for bringing that up, Dr. Hans. And yes, I was also going to say, for those who acknowledge the holiday, I just hope it's a peaceful one for you. For those who are hurting because of this holiday, I also see that, and that's valid as well. But yep, I will see you all next week.
Thank you. Couple quick items. One, I wanted to mention, Dana referenced about the work we do with veterans. When I was up at the conference, I did make a point of going to the veterans, the State Veterans Commission had their number 2 person there. And the state does something very interesting. Rather than reinvent the wheel and try to create all the services, they connect veterans to existing services and existing providers. So through us, if you know a veteran, if it's food security, homelessness, suicide prevention, you can call here. We can get you through to the state or through our resources to get that veteran help because they deserve it. Second, on a more somber note, next Thursday will be the 2-year anniversary of the Oxford shooting. And although it is a painful remembrance, we are also thankful for so many people who step forward to help the community, the families, and Oxford is a resilient community. And we are still learning from that process. There's still, unfortunately, the court cases and everything are a reminder, a negative reminder, but there are so many positive things that happened and so many people who stepped forward, including many of our providers who did that and law enforcement, and we're thankful and grateful for all of them. Last, I did want to take an opportunity to remember a champion who passed away this past week for mental health needs, and that is our former First Lady, Rosalind Carter. And I wanted to read from a press release that I happened to spot, and it said, "She was a champion for equal rights and opportunity for women and girls, an advocate for mental health and wellness for every person, and a supporter of the often unseen and uncompensated caregivers of our children, aged loved ones, and people with disabilities." It almost sums up what we've seen tonight with our guests this evening, as well as the discussions that we've had. So when you are thankful this Thursday with family and friends, be thankful for our former First Lady, who was a champion and way ahead of her time. You got to remember, she was First Lady 1976 to 1980, over 40 years ago, and we're grateful for her being a leader in the mental health funding. That's where she was. She had the moment, and she seized it, and you got to be thankful for people like that. So on behalf of all of us on the board, have a happy Thanksgiving, safe travels wherever you're going, and we hope you enjoy time with family and friends and a few days off. Thank you very much. We stand adjourned. We're getting there. I'm learning. Driving here today, I said,